A young lady reports to a doctor about having blood in urine. She might ask what could be the possible reasons for that. Well, let me tell you all the possibilities of someone having the specific sign of hematuria and let us get to know about its cause and investigation strategies today on sqadia.com. Blood can appear in the urine from pathology at any site in the urinary tract. Even small quantities of blood can produce a significantly pink or red coloration in the urine. Remember, this should not be confused with ingested substances that discolor the urine, such as beetroot or rifampicin antibiotic. The small amount of blood found occasionally in urine from patients with glomerulonephritis can make it smoky in appearance. Urinary dipsticks are very sensitive to even a very few red cells in the urine. False positive dipstick tests for blood can be obtained with the presence of free hemoglobin or myoglobin in the urine and by contamination from menstruation. Hematuria can be confirmed by finding more than 3 red blood cells per high power field of spun urine. Hematuria can be divided into two types, macroscopic and microscopic hematuria. Macroscopic frank blood hematuria requires investigation because it may be the first presentation of a carcinoma of the renal tract or a serious renal disorder. The continuing presence of microscopic hematuria present on a dipstick and seen on microscopy should prompt consideration of the presence of renal disease. Is there proteinuria, abnormal creatinine, or hypertension? Or a structural lesion of the renal tract but can be detected in a large proportion of asymptomatic normal individuals, that is, from 1% of young adults to 10% in the elderly. So guys, that was all for the intro. Stay with us as we will be learning about etiology of hematuria ahead and then we will look at the diagnostic approaches to find the underlying cause. So stay tuned.